At the Younger Facial Surgery Center, we see patients who may want to change the shape of their nose, but additionally, they may have breathing issues. It's very important to assess these patients in depth, looking into the nose, using an endoscope, dynamically looking at the airway to see what's potentially obstructing and what's not, and what can be fixed and what cannot. And so many of the patients who we operate on are not only changing the shape of their nose to put their nose into better aesthetic balance, but they got breathing issues. And these can both be addressed at the same time in most circumstances. With regards to patients who have breathing problems, many of our referrals are from family doctors here in Vancouver. And patients will come in and they may have been thinking additionally about changing the shape of their nose, and in those circumstances they can get a referral from their family doctor, which pays for the consultation. And many of the patients we see with breathing issues may come in through that route, and they can address the concept of improving their breathing and maybe changing the shape of their nose at the same time. And again, thorough physical examination, airway, aesthetics, computer imaging, they can be achieved here at the Younger Facial Surgery Center, and talk to your family doctor about that if you've got that issue. Most of these patients who undergo an airway operation are back to work in about 10 days, and if in fact they change the shape of their nose at the same time, it's about the same time frame. It's about a 10-day downtime following the surgery, and they get back to work. However, if they're employed in a very strenuous work situation, they may want to take 2 or 3 weeks off, but for the average patient, 10 days you're back to work. If you're thinking about having a rhinoplasty, really, all you need to do is to call the Younger Facial Surgery Center, talk to one of our assistants, they'll book you to come in, consultation, and you can go from there.